my interests are in transoral robotic surgery and clinical trials related to those. So my talk at this meeting is specifically on potential pitfalls of TORs and avoiding complications. The most worrisome is bleeding afterwards. So this is unlike surgery in other parts of the body, say on your arm. When the surgery's done, the skin is closed, it's stitched up. In the back of the throat, you can't do that. So it's left open, it's raw, and these patients have a risk of bleeding as the scab essentially falls off. So there are techniques that if you have done this a lot, like I have, that you learn and adopt to minimize that risk. There's a lot of dissection techniques, ways to minimize deeper trauma. So robotic surgery is really dependent on visualization of the tissue. That supplants haptic feedback. You can't feel the tissues. So maintaining good visualization, a clean, dry field is very important. And then in particular, management of the arterial blood supply is very important. So these patients generally need a neck dissection, which is an external procedure. And when that's done, ligating the branches of the carotid artery that supply the wound area is important to prevent catastrophic bleeding later. It avoids, this approach, transoral robotic surgery, avoids splitting the jaw for access. That's the big advantage over traditional approaches. It also can be incorporated into a multidisciplinary approach whereby patients who have surgery may be able to receive a lower dose of radiation or no radiation or avoid chemotherapy after treatment. So there's potential advantages even against other non-surgical treatments. I think it is going to be. I think robotics are going to expand significantly in surgery in general and oncology in general. I liken it to the first generation cell phones that were kind of clunky and not very useful. Technology is really advancing very quickly, and it'll enable us to have much more minimally invasive approaches to diseases compared to the past. So I think it will expand. There's already a strong rationale to use it now, and it's here to stay, I would say, but that's only going to increase over time. I think there's a lot of excitement for the role of robotic surgery in head and neck cancer, and I see that expanding in the future, but there is a learning curve to it and there are risks. And so it needs to be adopted with caution, and training is important to avoid complications down the road.